Levonorgestrel is a medication used by women to prevent pregnancy after birth control failure or unprotected sex. It is important to note that this medication is not meant to be used as a regular form of birth control. It will not stop an existing pregnancy or protect against sexually transmitted diseases. It is also important to be aware that this medication may not work well in women over a certain weight, or if certain other medications have been used within the past month, which can result in pregnancy. It is important to talk to your doctor for more details and to see if this medication is right for you. Additionally, it is important to check the ingredients on the label, as the manufacturer may have changed them and products with similar names may contain different ingredients meant for different purposes, which could harm you if taken incorrectly. When taking Curae 1.5 mg tablet contraceptives, it is important to read all the directions on the product package before taking the medication. If you have any questions, it's best to talk to your pharmacist. If your doctor has prescribed this medication, make sure to take it as directed. It is recommended to take one tablet by mouth with or without food as soon as possible after unprotected sex. This medication works best when taken within 72 hours, 3 days, after unprotected sex. If you happen to vomit within 2 hours of taking this medication, it's important to contact your doctor to ask if you need to repeat the dose. After taking this medication, you may notice changes in the timing of your period and the amount of bleeding. If your period is more than 7 days late, it's important to notify your doctor as you may need to take a pregnancy test. If you suspect a serious medical issue, seek medical help immediately. Some common side effects of Curae 1.5 mg tablet contraceptives may include nausea/vomiting, abdominal pain, tiredness, dizziness, changes in vaginal bleeding, breast tenderness, or headache. If any of these effects persist or worsen, it's important to inform your doctor or pharmacist promptly. If your doctor has prescribed this medication for you, it's because they have determined that the benefits outweigh the potential risks of side effects. Many people using this medication do not experience serious side effects. However, it's important to notify your doctor right away if you experience any serious side effects, such as severe lower stomach pain, especially 3 to 5 weeks after taking Levonorgestrel. While it's rare, a very serious allergic reaction to this drug can occur. Seek medical help immediately if you notice any symptoms of a serious allergic reaction, including rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing. It's important to note that this is not a complete list of possible side effects. If you notice any other effects not mentioned here, it's essential to contact your doctor or pharmacist. If you are in the US, you can call your doctor for medical advice about side effects, or report side effects to FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can call your doctor for medical advice about side effects, or report side effects to Health Canada at 1-866-234-2345. Before taking Curae 1.5 mg tablet contraceptives, it's important to let your doctor or pharmacist know if you are allergic to it, other progestins, or if you have any other allergies. This medication may contain inactive ingredients that can cause allergic reactions, so it's important to discuss this with your pharmacist. It's also important to discuss your medical history with your doctor or pharmacist before using this medication, especially if you have unexplained vaginal bleeding. Curae 1.5 mg tablet contraceptives may cause dizziness, and the use of alcohol or marijuana can increase this effect. It's important to avoid driving, using machinery, or doing anything that requires alertness until you can do so safely. Limiting alcoholic beverages and discussing the use of marijuana with your doctor is also important. Before undergoing surgery, it's important to inform your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. This medication should not be used during pregnancy. If you become pregnant or suspect that you may be pregnant, it's important to inform your doctor immediately. Curae 1.5 mg tablet contraceptives can pass into breast milk, but it is unlikely to harm a nursing infant. It's important to consult your doctor before breastfeeding while using this medication. It's important to be aware of any potential interactions with other medications. Some drugs may decrease the effectiveness of Curae 1.5 mg tablet contraceptives, leading to a higher risk of pregnancy. Examples of these drugs include griseofulvin, modafinil, rifamycins, such as rifampin, rifabutin, St. John's wort, drugs used to treat seizures, such as barbiturates, carbamazepine, felbamate, phenytoin, primidone, topiramate, HIV drugs, such as nalfinavir, nevirapine, among others. It's important to talk to your doctor or pharmacist for more details about any potential interactions. Be sure to keep a list of all the products you use and share it with your healthcare providers. And remember, never start, stop, or change the dosage of any medicines without your doctor's approval. If someone takes too much of this medication, it's highly unlikely to cause an overdose. However, if someone does overdose and experiences serious symptoms like passing out or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call 911 or your local poison control center at 1-800-222-1222. For Canadian residents, you can call a provincial poison control center. Symptoms of overdose may include severe nausea and vomiting. As always, it's important to take medications as directed and to seek medical attention if you have any concerns. Make sure to keep all your scheduled medical and laboratory appointments. This will help ensure that you are receiving the maximum benefits from Curae 1.5 mg tablet contraceptives. It is also important for monitoring any potential side effects or changes in your health. Taking this medication as directed by your healthcare provider is crucial for its effectiveness. Curae 1.5 mg tablet is a contraceptive used to prevent pregnancy. It works by preventing the release of an egg from the ovary and also makes the vaginal fluid thicker to prevent sperm from reaching the egg. It is a safe and effective method of contraception if used correctly. It is best to take the tablet as soon as possible after unprotected sex. The recommended dosage is 1 tablet to be taken within 72 hours of unprotected intercourse. It's important to store Curae 1.5 mg tablet contraceptives at room temperature, away from light and moisture. Make sure to keep it in a safe place where children and pets can't reach it. When it's expired or no longer needed, make sure to properly discard it by consulting your pharmacist or local waste disposal company. Don't flush it down the toilet or pour it into a drain unless instructed to do so. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.